So, calling everybody in Russia, anybody interested in pain, treating people in pain, we'd love you to join us for our Explain Pain course that Mark is going to be translating into Russian. What are you going to learn during the course? Well, the main objective for Explain Pain is an opportunity to reflect on your understanding of pain, be more dynamic with your thinking around pain, so understand your clients, your patients who come to your clinics. We will build some communication skills, and specifically we'll look at delivering education about pain and around pain as a part of your therapeutic approach for your patients. So hopefully I'll get a chance to speak to many different people and hear your experiences with your clients, with your patients, be able to give you some ideas, some skills to work with into the future.
Thanks a lot. And could you tell please a few words about yourself?
About myself, yes. My name's Tim Beams. I'm sitting, actually, it's just turning into a beautiful spring day in the UK. Professionally, I work and have been teaching with NOI for almost 15 years. The other parts of my work, I also work as a physiotherapist, treating people with complex and persistent pain, mostly people who have a condition called complex regional pain syndrome. And I also run events. I run a night called Le Pub Scientifique, where we invite scientists, researchers to come and share their work, and also clinicians to tell us how they integrate research into practice. So yes, that's me professionally. I studied pain and have a master's in something called Pain Science and Society from King's College University. I've been working in that field now solely for the last 15, 16, 17 years.
And could you tell some words about NOI, about Explain Pain conception, about biopsychosocial model? And
first of all, NOI is a company that was founded in Australia. David Butler was the founder of NOI. The original ideas about NOI and education was based on an understanding of the nervous system, and things developed hugely over the last 30 years, where first of all an appreciation that the brain might influence a pain experience, so more than just the nerves, and then perhaps we needed to understand the whole person. So NOI developed two sort of key areas that NOI are interested in. One is the research around understanding nervous system contributions to a pain state. So for instance, nerve injuries, and being able to assess for evidence of a change in nervous system function. And then the other huge area that NOI have been interested in is the delivery of education around pain to clinicians, but also to patients as well. So what we now know is if someone's in pain, if they receive individualized education around their pain, it will help them to recover. It will also have an effect on their pain that they experience as well. Explain Pain is an approach that encompasses more than just understanding tissues, more than understanding the brain's involvement in a pain state, but understanding the individual in front of us. So as you said, Mark, it's a holistic, uses a biopsychosocial framework to understand pain as an experience. And what we mean by that is pain, it's more than just a sensation, isn't it? Pain influences what you can do in your life. So it stops you from working sometimes. It can affect your relationships. People in pain, particularly when they've had pain a long time, you see shifts in their mood. But then there are other changes as well that we are discovering. So you see stress as an influence on a pain state as well. And something that we do in Explain Pain is we discuss the role of stress and stress biology, influences of the immune system as well in a pain state. So Explain Pain as an approach is trying to integrate everything that we know and understand about pain. So the best of science, put it into clinical practice. So So the best of the person in pain, the best of the individual. Explain Pain is, for me, a broad approach as well. It's a broad approach to understanding the person in pain. It's not just how I educate someone about pain, it's how I try and make sense of pain as an experience myself.
Explain Pain approach and NOI approach, it's like a primary source of information and understanding of pain.
Yes, Explain Pain, essentially it's using evidence, scientific evidence, the best of science, that is changing as well. So, it's a continual updating of our knowledge about pain that we gather from various different scientific areas. So Explain Pain takes evidence from psychology literature, philosophy literature, the neuroscience, neuroimmunology, endocrinology, and it's trying to just put all of that together essentially into rehabilitation. How do you rehabilitate the person in pain? And it's using all the evidence that we have got from science to offer that person a way forward.
How do you think, who definitely should visit this course and who definitely shouldn't?
I'm biased to think everybody should visit the course, but I appreciate not everybody will want to. Many people will find this challenging. When I visited Russia 2 years ago, there were a number of people that are challenged by the ideas that we're proposing, because for some people it's very, very new. The idea that we integrate the individual in their care, so doing what we would call a patient-centered approach, for some people it sounds crazy. As the doctor, it should be you who are dictating what that person does or how they're treated. And actually what we're saying with Explain Pain is giving someone the knowledge and the understanding. They then are able to make the best decisions for themselves going forward. If you think you are the person who should dictate what that patient does, then this course isn't for you. If you're open to change your understanding or challenge your understanding, and you want to grow your knowledge of pain, but also grow your ability to be able to treat people effectively who are in pain, then this is for you. And we've had many different disciplines, many different professions, and we have had a number of people who are currently in pain sort of course where you gain knowledge at a number of different levels. I think it should be open to anybody interested in pain.
So that's not only about theoretical part, but practical part, of course, and workshops will be on that too.
Yeah, absolutely. So an important part of the course is that you need to do some thinking. You'll be speaking to each other, doing some problem solving, putting it into practice as well. You'll be expected to do some speaking as well on screen, as you would expect to do if you're in your clinic.
Thanks a lot, Tim.
Thanks, Mark. See everybody in May, hopefully.